Have you ever stood up from a chair and felt your knees protest with a small click, a sharp twinge, or a stiffness that makes them feel locked in place? If the answer is yes, you're definitely not alone. Many people over 60 experience the same thing. Going down the stairs suddenly feels like a challenge. Walking just a short distance makes the knees feel heavy, or every morning requires a few warm-up steps before you can move comfortably. But here's the good news. This doesn't mean you have to live with knee pain for the rest of your life. In fact, your knees can improve when you take care of them the right way. I want you to imagine something. Every time you stand up, every step you take, every moment you go down a staircase, your knees are doing a lot of work. But over time, the muscles that support the joint, especially the quadriceps, glutes, and calves, weaken due to inactivity or because you unconsciously avoid moving out of fear of pain. When these muscles fall asleep, the knee is forced to carry more load than it should, leading to pain, tightness, or that grinding sound many people mistake for severe arthritis. This creates a cycle that's hard to escape. The more it hurts, the less you move. And the less you move, the more it hurts. Today, I want to give you a different perspective. Knee pain isn't the end of the road. It's your body's way of asking for help, and you can absolutely give it that help through gentle, simple habits you can do right at home without equipment or complicated exercises. Just a few minutes a day spent reactivating the weakened muscles can make a remarkable difference in just a few weeks. Walking feels more stable, stairs become less intimidating, and the discomfort decreases significantly. In my years of working with older adults, I've seen many cases that seemed hopeless, but recovered beautifully once the right exercises were introduced. Some people truly believe their knee pain was just an unavoidable part of aging. Yet after 3 consistent weeks of training, they returned with a smile, proudly saying, "I can go up the stairs without holding the handrail now." These real-life transformations are exactly why I'm sharing these helpful habits with you today. And before we dive into the specific exercises and routines, I'd like you to take just a second to do something simple but important. Comment 1 if you're ready to improve your knees and willing to practice these habits. Or comment 0 if you're still unsure and want more information. Just one little number helps me understand where you are on this journey and allows me to guide you more effectively in the next steps. Once you understand that knee pain isn't a final verdict, but rather your body's way of asking for attention, you step into a more important stage, understanding why simple habits can create such powerful changes. In reality, many people believe knee pain comes from worn-out cartilage that can't be restored, but that's only a very small part of the story. What most people don't realize is that the weakening of the surrounding muscles is often what forces the knee to work far harder than it should. When the quadriceps aren't strong enough to support the leg, when the glutes aren't stable enough to keep the leg aligned, or when the calves aren't flexible enough to help circulation, all the pressure shifts directly onto the knee. That's exactly what causes discomfort every time you move. The truth is, the knee doesn't work alone. It's part of a tightly connected system that includes the hips, ankles, quadriceps, hamstrings, glutes, and even the circulation pathways in the legs. If just one part becomes weak, the others have to compensate. And over time, that compensation turns into pain and instability. That's why the exercises you're about to learn don't just target the knee. They help restore the entire movement chain of your lower body, giving you back the natural mobility your body was designed for. Another interesting thing is that older adults respond extremely well to small but consistent changes. You don't need heavy workouts. You don't need to push through pain, and you don't need to spend hours every day doing complicated routines. Instead, gentle movements performed with the right technique, repeated regularly, are the true golden key to making your knees stronger and more flexible. Many of my patients are surprised by how just a few minutes each morning can ease stiffness, and how after only 2 weeks, the once dreaded action of standing up or sitting down becomes noticeably easier. At this stage, the most important factor isn't how many exercises you do, but how well you listen to your body. Older knees respond quickly when something is right and are equally honest when something is wrong. A range of motion that's too large, a slight misalignment, or pushing through excessive pain can all lead to swelling, stiffness, or irritation. That's why, as you move forward on this journey, it's essential to maintain a sense of gentleness, awareness, and patience. The improvements you're looking for won't come from forcing your body. They come from consistency and understanding your limits. In the next section, you'll begin exploring each specific habit, movements that have been clinically proven, tailored for older adults, safe for the joints, and easy to perform at home. But before you begin, keep one simple mindset in place. Your body can adapt and recover as long as you give it the right signals and the time it needs. That's the foundation that will carry you forward as you reclaim the strength and confidence in your own legs. Once you understand why knee pain occurs and why the surrounding muscles play such an important role, it's time to move into the most practical part. 5 simple but highly effective habits you can start doing right at home. These exercises don't require strength, special equipment, or athletic ability, and they're especially suitable for older adults. Their purpose isn't to turn you into an athlete, but to restore mobility, stability, and confidence in every step you take. What these 5 habits have in common is that they target the entire movement chain of the leg, from the hips and thighs to the knees, calves, and circulation. When done consistently, they reduce pressure on the joint, improve smoothness in movement, and strengthen the muscles that have been asleep due to inactivity. Beyond that, these exercises also help improve balance, lower the risk of falls, and increase your control when standing up, sitting down, or climbing stairs. The first habit focuses on waking up your knees as soon as you get out of bed, reducing the morning stiffness that many older adults experience. This is one of the most important steps to start your day without being held back by discomfort. The second habit activates the quadriceps, the strongest muscle group responsible for supporting and protecting in your knee. Just a few minutes each day can significantly reduce the strain your knees carry with every movement. The third habit moves up to the hips. When the hips are weak, the leg alignment shifts and the knee ends up absorbing abnormal pressure. By properly engaging the glutes, your entire leg becomes more stable. The fourth habit strengthens the calves, the circulation pump of the body. When these muscles work efficiently, they help reduce swelling, lightening the legs, and supporting better nourishment of the knee joint. And the final habit brings you into the most practical movement of daily life, climbing stairs with control. This habit helps you apply your new strength to real-life activities while checking how well your knees are adapting. These exercises may seem small, but they carry tremendous power. They're built on principles of physical rehabilitation, clinical experience, and the real-world success of thousands of older adults. When practiced correctly and consistently, your knees will gradually shift from painful and weak to steady, light, and flexible week after week. After learning the 5 essential habits that help reduce knee pain and improve stability, the next thing you need is a clear, structured plan to apply them safely and effectively. A good training plan gives your body time to adapt to new movements, prevents overload, and gradually creates positive changes day by day. This isn't a heavy workout program, nor does it require strict discipline. Instead, it's designed to fit the lifestyle of older adults, gentle, flexible, and still scientifically sound enough to deliver meaningful results. During the first 2 weeks, the main goal is to get familiar with the movements and reactivate the weak muscle groups. At this stage, your focus should simply be on proper technique and paying attention to how your knees respond. Each morning, the knee wake-up routine should be done consistently because it helps reduce morning stiffness and prepares your joints for movement throughout the day. It only takes a few minutes, yet it lays the foundation for easier standing, walking, and stair-stepping. Along with that, alternate between 2 key habits, activating the quadriceps and improving calf circulation. These exercises should be done on different days to avoid fatigue. For example, 3 days a week can be dedicated to controlled sit-to-stands, while 2 days are reserved for heel raises. Rotating like this allows your muscles to rest appropriately and gradually adjust to the new level of activity. By the 3rd week, once your body has begun adapting, you can start incorporating hip-strengthening exercises. This is the perfect time to focus on your glutes, as they play a crucial role in maintaining proper leg alignment and reducing pressure on the knees. You don't need to do them daily, just 2 sessions per week are enough to noticeably improve your gait and overall stability. At this stage, you can also try adding controlled stair stepping at the end of the day. However, only do this if your knees are no longer feeling sore, swollen, or heavy after the previous exercises. Stair work isn't meant to be a heavy workout. It's more of a gentle assessment that helps you see how well your muscles are working together. Throughout these 3 to 4 weeks, each session should last only 10 to 15 minutes, and your pain level should not exceed 3 out of 10. If you feel mild soreness or tightness the next day, that's a normal part of the recovery process. But if the pain lasts more than 24 hours or you notice swelling, simply reduce the range of motion, lower the number of repetitions, or take an extra day of rest. The key is to move within safe limits, because consistency and gentleness are what lead to long-lasting results. This 3 to 4 week plan, it is more than just an exercise schedule. It's a process of reconnecting with your body, gradually rebuilding confidence with every step you take. Day by day, week by week, you'll notice small but meaningful improvements. And after a month, you'll feel real, tangible changes in your knees and in the way you move. When starting a new exercise routine, especially for older adults or anyone who has dealt with knee problems, it's very easy to make mistakes. This is completely normal because your body is relearning how to move after a long period of limited activity. However, there are a few common mistakes that, if recognized early and corrected promptly, can make your recovery faster, safer, and noticeably more effective. These 3 mistakes are the ones I encounter most often in real practice, along with simple fixes you can apply right away. The first mistake is pushing yourself until it hurts. Many people still believe that the more it hurts, the better the results. But when it comes to knee health and rehabilitation exercises, this is a serious misconception. Pain is not a sign of progress. It's your body warning you that the tissues are being overloaded. When you push past your comfort limit, the knee can become irritated, leading to swelling, warmth, and prolonged soreness. The fix is simple. Always stay within a pain range of no more than 3 out of 10. If a movement increases your pain, reduce the range of motion, cut back on repetitions, or rest for a few hours before trying again. What your body needs is stability, not force. The second mistake is focusing only on the knee and ignoring the surrounding muscles. When knee pain hits, many people spend all their effort flexing and extending the knee, massaging the knee, or doing exercises that target only the joint itself. But the knee doesn't function on its own. It depends heavily on the strength of the quadriceps, glutes, calves, and even the mobility of the ankles. If just one of these areas is weak, the knee ends up absorbing all the periosteum, making the condition worse. So instead of isolating the knee, keep things balanced, strengthen the glutes to stabilize leg alignment, strengthen the quadriceps to reduce load, and strengthen the calves to support circulation. When the entire movement chain improves, knee pain naturally decreases and long-term stability increases. The third mistake is using incorrect form or lacking proper support. This often happens with exercises like sit-to-stands, side leg lifts, or calf raises. A slight misalignment, knees caving inward, leaning too far forward, or lacking a stable object to hold on to, can cause you to lose balance or place stress on the wrong parts of the knee. In the early weeks especially, make your environment as safe as possible. Use a sturdy chair, hold on to a wall or countertop when needed, and move slowly so you can feel the correct muscles working. If you feel your thighs, glutes, or calves activating, that's a sign you are performing the exercise correctly. When you avoid these 3 fundamental mistakes, your training becomes smoother, safer, and far more effective. The best part is that these adjustments don't require advanced technique or special equipment. All you need is awareness, patience, and control. The body, even in older age, has an impressive ability to adapt. And it's the precision in each movement that guides you back to natural strength and mobility. Once you've begun maintaining a consistent exercise routine, an equally important skill is learning to listen to the warning signals your body sends. Not every discomfort is dangerous, but there are certain signs you should never ignore. Knowing the difference between normal muscle adaptation and signs of overload or injury will help you protect your knees proactively and avoid unnecessary complications. One of the clearest warning signs is noticeable swelling in the knee or swelling that doesn't go down within 24 to 48 hours. Swelling is your body's response when soft tissues become irritated. If it lingers, that's a sign the joint is under more stress than it can currently tolerate. In this situation, you should pause your exercises, apply a gentle cold compress, and allow the knee to rest until the swelling subsides. Another red flag is a loud crack or pop, accompanied by a sharp, immediate pain. It's common for older knees to make mild clicking or grinding sounds, and most of the time that's harmless. But if the noise comes with a sudden, stabbing pain or prevents you from taking another step, it may indicate ligament or meniscus damage. In this case, stop exercising immediately and see a doctor for proper evaluation. You should also pay attention if the knee becomes stuck or locked, preventing you from fully bending or straightening it. The sensation that something is caught inside the joint, making movement feel blocked or uneven, often relates to a meniscus issue or soft tissue getting trapped. This is not something you should try to exercise through. It requires medical assessment. Another sign to watch for is the knee suddenly giving way, buckling, or feeling unstable while you walk. This often indicates ligament weakness or instability in the joint. It's particularly important to take this seriously, as continuing to exercise without support could increase your risk of falling. Night pain is another important warning signal, especially if it wakes you up. This is not a normal part of muscle recovery. Persistent nighttime pain usually suggests inflammation or a deeper issue within the joint. If this happens, continuing your exercise routine may worsen the problem, so it's best to stop and consult your doctor. Finally, to help your doctor assess your condition more accurately, consider keeping a small training log. Note which exercises cause discomfort, when the pain appears, how long it lasts, and whether swelling accompanies it. This information gives your healthcare provider valuable insight and helps tailor your plan safely. As you reach the end of this journey, I want you to pause for a moment and reflect on yourself. You may have started reading the first lines with worry about your knees, with fear every time you stood up, or with the discouraging feeling that your legs were no longer as flexible as they once were. But now you're equipped with something powerful. 5 simple yet effective habits, a gentle 3 to 4 week training plan, and the key insights you need to exercise it correctly and avoid common mistakes. These aren't just ideas to read and forget. They're reminders that your body still has a far greater ability to recover than you may realize. Your knees didn't weaken overnight, and they won't become strong again after just a few sessions. But every small movement you make each day, every slow, controlled stand-up, every gentle heel raise, every light kneecap mobilization in the morning, is a vote you're casting into a box labeled long-term health. No one can exercise for you, but you are the one who will feel the full transformation as your knees begin to loosen, your steps feel lighter, and your fear of movement slowly fades. The most beautiful part of this process isn't the strength you gain, but the return of your confidence in your own body. Many older adults used to believe knee pain was the end of the road, something they simply had to accept. But they were wrong. And so are you if you have ever thought of the same. The human body has an extraordinary ability to adapt. All it needs is your patience, your respect for its limits, and the belief that each day can be better than the last. Remember, you don't need to move fast. You just need to move in the right direction. A few minutes each day are enough to create meaningful change if you stay consistent. These gentle movements will gradually become habits, then a lifestyle, and eventually a foundation for a fuller, more active life. From walking in the park, to climbing a few stairs without hesitation, to enjoying joyful moments with your family without being held back by pain. If you've made it this far, it means you truly care about your health, and that alone is an enormous step forward. You're ready for a new chapter, one where each day gives your legs another chance to grow stronger. With persistence, you'll notice changes not only in your knees, but also in how you view your body as a whole. Treat every movement with care and give your knees the gentleness they deserve. When you care for them properly, they will reward you with freedom in every step. And one day, perhaps sooner than you think, you'll realize that you've moved past the worry, overcome the pain, and reclaimed the mobility you once feared was gone for good.